video, so now I will. All right. So considerations for the summer and fall and federal funds overview for the CARES Act, and a little bit of flexibility around the federal funds. So we won't go into great detail today. I just kind of want to have it there to mark the importance of those topics as we continue to roll that out. I think I have Corey Epler on as a panelist to talk a little bit around the teaching and learning front, and probably also we'll talk a little bit about the executive order request as well. So Corey, you're welcome to unmute and join me and for a bit of the dialogue here. But the certainly as we're having conversations around where we go for summer and fall, I mean, I want to reiterate that I think that this summer or certainly as we go into June, it's going to be difficult to have kind of anything other than or at least as far as we can tell right now, I think planning for kind of remote learning environments for the summertime makes quite a bit of sense for us. And probably continuing on that front is going to be important. I also would highlight that that we probably continue to have conversations, and I want to be able to have thoughtful conversations about how we're planning for the fall. I know there's been a couple of articles in the papers, and I've appreciated feedback, even the harsh feedback, I suppose, on, hey, look, maybe too much too soon for folks. So understanding that, understanding also that we kind of have to be starting to do some of that thoughtful planning for whatever may happen is going to be important. And so we want to continue to do that. But Corey, did you want to talk a little bit about the considerations for teaching and learning and some of that coming forward, or maybe already has gone out actually?
Yeah, sure. Thanks, Commissioner Bloomstead. One thing too, I just might mention on the considerations for summer learning and into the fall. Our team is working on really thinking about kind of a coherent scope around the progressions of learning, specifically in English language arts and mathematics. So really trying to figure out where we think students might have been mid-March, and then trying to provide standards-based resources that would support summer learning over the course of several months that would ultimately prepare them for the fall. So that information will be coming out probably within the next couple of weeks, but really trying to help identify that coherent scope around the standards and thinking about the resources that would support that. Commissioner mentioned the considerations for teaching and learning, and we did share a guidance document that went out last week. And I joke because I would have liked it to gone out about 10 days sooner, but that seems to be, where we're at with some of that. So specifically, that resource provides just some guidance around school culture, communicating with families and caregivers, questions around scheduling, some guidance around grading, obviously to the critical need for professional learning for our educators in this sense. The other thing that I might mention too, we call out in the start of that document that we're asking districts to consider making their continuity of learning plans known to the public. So we are getting some requests around those specific plans. So our recommendation would be to try to make them a public-facing document, simply because it's a great tool to communicate your expectations with the members of your community. We'll continue to just provide resources and supports for this. I try to communicate with curriculum contacts and with superintendents and ESU administrators. But if you ever have a question or don't get something, feel free to reach out to me. Trying to cover all of our bases on those resources. But if you do have any specific questions, again, I'm happy to try to answer those as well. Anything else, Commissioner, on that you think that?
Challenges I might be facing is an internet challenge. So
you are a little bit choppy today. All right. Thank you.
Yeah, thanks, Corey. So hopefully I stick with you. I just switched internet providers just like that. So anyway, the reality I think for for us as we keep going forward, as Corey said, I mean, part of that continuity of learning plan obviously was rolled out very quickly. I know schools had to make a lot of very quick decisions and move in that order. I wanted to highlight that we've also been in a lot of conversations about the types of things that the Department of Education can waive versus the types of things that the governor can waive. And the responsibilities kind of as, you know, I know the state board and granted kind of some broad authorities to me, but even in the midst of that, I still can't waive things that are really reserved for the governor. But we actually tried out our very first one. In fact, we have an executive order. I think it's order, I want to say it's 2020, which seems appropriate, I guess. But the executive order is actually waiving the requirements for the administration of a system of assessments for student learning for this school year, also waiving some of the accountability requirements and the requirement for us to actually run the accountability system as we traditionally have. And then finally, or not finally, I guess there's two more things. There's the reading assessments as it impacted the Reading Improvement Act, and part of that and how that's going to be implemented. And basically it provides some, I'll call it wiggle room for lack of a better term, relative to how we interpret the Nebraska Reading Improvement Act. And so it doesn't, every letter of the law there doesn't have to be carried out, but it doesn't prohibit it from being carried out in schools either. And then also well, I guess those are the primary things. The order is effective immediately, so we've done that. What I would highlight is also, those are all new tricks, I would like to say, for us at the department, of asking the governor to waive certain laws. And so this was kind of one step on that process. If there are other laws, we kind of have now a bit of a working approach with the governor's office in order to make those things happen. And so there'll probably be at least maybe one more that we might consider putting in front of the governor as we continue to do that particular work together. So appreciate that very much. I'll go ahead and move maybe on to the next slide, which I think gives us a chance to bring in our ESU representatives. And I think we have Craig Lofquist and Dan Schnoe. So I thought we can talk through some things, and Craig's got an interesting picture up, but at least he's got a mask on. So anyway, the reality for our ongoing work around the state, I'm very appreciative of ESU's kind of facilitating conversations so we can have as many voices and opportunities to communicate as possible. But I really want to kind of turn it over to Dan and Craig to kind of highlight a few of these various points, and I'll try to address them, and then I'll reserve all the hard questions for Corey Epler or other members of our staff. So how about that? So Craig and Dan, would you want to start to run through this list with us?
Sure. Matt, on behalf of all of the issues, and I think everybody we want to thank you, the governor, and Dr. Antone for the ongoing communication. I think that's probably right now the most important thing that we keep talking about is the quality ongoing communication. We talked about all of the issues that you had addressed in your opening, your highlights, the CARES Act, summer school waivers, and then even broaching the subject of fall in the event that we have to make some adjustments there. So we know that there's not hard and fast answers on a lot of this. And I think some of these issues that may seem a bit obscure are going to keep coming. One of the things that was mentioned is we're supposed to have so many fire drills during a school year. And it looks like, we're starting to maybe work out the executive order situation or / waiver. So any help and guidance that you can give us there, I think would be appreciated. And I'll turn it over to Dan and let him share. So thank you.
You bet.
Commissioner Dan Schnoes, good afternoon. Just one question, just a follow up from Dr. Lofquist on communication. Do you see that we're going to continue with these meetings on a weekly basis for the time being?
Yes, I do. And I think, honestly, I think part of where we'll go with these going forward, I think we'll keep it in this kind of time frame. I do hope to kind of turn it into kind of back to our Q&A thing. We've kind of, like, speaking of new tricks, I know the open chat creates some challenges, but there is a Q&A function. And I think we're going to turn it on today, but I'm not sure we'll have enough time necessarily in the end. But there'll be some way that we actually start to feature that back in these meetings as well. So hopefully that'll be helpful for folks. So sorry, it's not, well, like I said, we haven't learned all the new tricks yet, but that's the intention there. So
That was one of the recommendations we heard from a number of superintendents across the state, was to look to add that feature back in, just so they could maybe get a couple of the key questions answered by the time they got down to the end. The number two thing is we're looking at the executive order coming out. Do you know when that will actually come out, that we'll be able to see it?
That I don't know for sure. I got an email on it, and it's actually signed and sealed. So I don't know where they're placing those. So we can put it up on our website if we haven't already, at least. So
Okay.
that
Second
we'll get
follow-up question with that is then the waiver process. It sounds like we'll have to go through with individual districts, and we've been talking about this for a couple of weeks, and I think that process is moving along. Do you know when that maybe a template for the accreditation process for Rule 10 that we could help with our districts getting those out? I know there's a couple of law firms that are starting to work on a couple of ideas in case they're called on. So any idea where that's at?
Yeah, in fact, I know that there's actually a provision of the law, and I think I just seen some conversation about that here today, of where there's a possibility of folks submitting something as an approach anyway to kind of get engaged with the department on those fronts. I'll talk to, or maybe I'll have, I don't think I got Brian Halstead on the call right now, but what I was kind of contemplating was we'll put out a little bit more guidance on that front. What we want in the end of this, there's an affidavit approach underneath Rule 10, but underneath the law, there's this opportunity for the state board to waive the rules requirement and other things underneath an epidemic like this. We'll do both. Brian just texted me, so maybe I've got another answer. I don't know if Drew, if you can turn Brian's on to be able to chat with me a little bit on that front. But anyway, we'll build a process that does that, Dan. I appreciate kind of the back and forth conversations of that. There are several different rules that might be impacted too, beyond the rules, or excuse me, beyond the hours portion of Rule 10. And so we want to actually make sure that folks have an ability to kind of check off all of those different approaches and concerns. So that's part of that ongoing work, and it'll be out pretty soon. But again, appreciate the feedback on that approach. So
hey, Commissioner, this is Corey. I just wanted to mention that the executive order is linked from our coronavirus website, so it's at the very top. So if you go from the main NDE page to the coronavirus page, that executive order is posted.
So, and Drew, hey, I just got a text from the governor that he apparently is on, but still muted. So I'll ask him what number he's dialed in on.
So while you're looking, Commissioner, I had a quick question for Corey. One of my superintendents was asking about summer school, and it sounds like you're going to come out with a number of guidelines, and the emphasis is going to be on doing this virtually or using remote learning. And then for Corey, do you know if some of the same guidelines are going to be in place, such as, school lasting at least 12 days, 3 hours a day, and some of those guidelines?
As I'm working through, as the questions I get around summer school, some of them are connected back to some of the funding pieces. So I think our guidance, I've been intentionally not using the phrase summer school as opposed to summer learning, because I just think there's going to be a lot of different frameworks that a district would be able to use. So some of the questions that relate to some of the specifics as it's connected to funding, I've just been referring people back to Bryce Wilson on that. So I know Bryce is probably listening, so he can thank me later too.
All right, thank you. Well, the last one that we wanted to touch base on, it sounds like we're going to hear more about the CARES Act and how the funding is going to hopefully come forward to some of the schools. One question that came up was if we have some federal grants that we're currently operating with this year, but because of the situation, we're not using all the federal funds. Do you know if there's anything in the works for any carryover of those dollars moving forward? Because, you know, typically those all get spent by the end of the fiscal year.
And actually, I think it goes to some of the federal flexibility around those funds, but we'd also have a state version of that. And so I don't know that I have the exact answer on those fronts, but I know that's one that we've had conversation about, the flexibility of those particular funds being able to be rolled over into the next year. So Dan, I'll make a note of that and be able to take that one on, I think. And I suspect Bryce is on the call listening in, so we can cover that in a future call too. So thanks for that. So
No, perfect. We just wanted to get that on your radar for you to look at. I think that's all I have, Commissioner.
well, I really do appreciate it, and we will have a chance to kind of chat a little bit more. I'm going to actually jump up to the governor is on, and I think I'm going to go ahead and advance the slides. Governor, I think I'll have the governor go ahead and make comments. I know Gary Antone's not going to be able to be on. And so what I put down on slides, Governor, not that you have to hit all these in this order or any order, but I put just down mental health, what I just mentioned, our executive order. So thanks for signing that. And then if there's anything else around graduation you and I wanted to chat about while we're together, but and then any other topic you want to bring up. So thank you for being with us, Governor.
Oh, no problem. Thank you for having me on and for bumping me up. You didn't have to do that. I appreciate it. Yeah, just we'll start with that first one on mental health. And, you know, similar to the request I'd made a while ago with regard to just seeing what, as you have interface with families, keeping an eye out for children who may be at risk. That's something that we get, obviously a lot of the calls to the hotline come from educators, and without the kids being in the classroom, that may be more difficult. We asked to think about ways that you might be able to help with that. And I would say mental health falls in that same sort of category. On Friday, we had the Association for Behavioral Health Providers come in, former Senator Annette Dubas is the executive director there, and we had Sherry Dawson in, and just reminding people that, you know, our whole program, Stay Home, Stay Healthy, Stay Connected, includes the stay connected part, which is when when we have isolation that can lead to depression and other issues, anxiety with regard to mental health, and that mental health is just as important as physical health, which should be treated exactly the same way. You know, if somebody had a chronic condition like diabetes, you wouldn't be embarrassed about telling people you went to the doctor because you had an issue or something. Well, it should be the same thing with mental health. And again, to the extent that you can get that message out there to your families that it's okay to ask for help. There's the family hotline out there. There's a suicide prevention hotline. The Nebraska Family Hotline is 1-866-866-8660. The suicide prevention hotline is 1-800-273-TALK. So those are out there to be able to get that. In fact, I think over the weekend, the World Herald did a nice op-ed on this too, talking about mental health issues. So again, just another thing. I know you got a lot of on your plate already, and you don't need anything more, but I just thought I'd just raise that awareness as something to maybe be thinking about how you might be able to get that out to families if you see somebody who looks like they may be in need. And happy to do the executive order. So I think you've already talked about it. I'm not going to spend any more time on it. Graduation, again, Commissioner, you're putting out guidance there with regard to that. So happy to support the guidance that you're putting out there. Obviously, like down in Red Cloud, they were able to get one in under the guidelines, but certainly support your efforts with regard to how you want to handle that across the state. And then just with regard to other topics that you may be interested in, we did do our first announcement today of the loosening of a restriction. It has to do with elective surgeries. You know, just because they're elective surgeries doesn't mean they're unnecessary surgeries. They're just planned, and that it's a lot of things that Nebraskans need. So what I announced today was that starting May 4th, that if a hospital would like to do elective surgeries, they can, if they have 30% of their hospital beds open, 30% of their ICU beds open and 30% of their ventilators open. Now, put that in perspective right now, if you look at Omaha, in general, we've got 408 ventilators in the Omaha area. 96 of them are being used, 21 of them for COVID patients. There's plenty of capacity in Omaha. However, if you look at, for example, say St. Francis in Grand Island, they've got 16 ICU beds, 14 of them are being used right now. They would not have the capacity to do it. So it is something that would be on a hospital by hospital basis that hospitals would be able to use that. It also would cover dentist's office, ambulatory surgical centers, veterinarian services, and so forth. So all these folks will be able to, if they've got, oh, and by the way, you have to have 2 weeks of PPE as well. So with those those guidelines and those restrictions, hospitals will be able to start doing elective surgery starting May 4th. We are also pursuing additional testing. We have gotten the public health labs. Public health labs is starting to really hit their stride as far as doing that. We've obviously got the help of UNMC. We've got the hospitals like CHI and Bryan. We've got the commercial labs like Abbott. We were able to get 2,000 tests back over the weekend, so that was very good to help us get more testing done and seeing what's going on. We had 348 positives over the weekend, which, again, if you're going to do more testing, you're probably not surprised you're going to get more test positives. Almost half of those were from Hall and Dawson County, so our current hotspots were delivering half of those. But even with the increase in testing positive, we still have been able to manage the healthcare system, so we haven't overwhelmed it anywhere, like in Grand Island, and we think we're feeling pretty good about Lexington, and we'll have to continue. Again, we got the kind of the heads up with the testing that we did there, so we know that probably about a week from now, we're going to see a lot more hospital cases, and we're getting ready to be able to handle that or transport those people by getting ambulance services ready. We're going to push some ventilators out to Lexington and North Platte, so getting prepared for what we see coming down the road. And we're looking for additional ways to continue to do testing. The federal government's reached out with all the labs in Nebraska that potentially have machines that could do testing, even if they're low throughput, so we'll be following up with them. And then we're looking for our own channels to be able to do that as well, to be able to expand testing. And then to go along with expanded testing, kind of the idea is you do more contact tracing. And we're going to be looking to expand our ability to support local public health districts with regard to contact tracing as well. That's probably going to take a couple weeks to get up and running here, but we're going to get working right away to be able to get people trained up and provide supplement for that so that we can know who has been in contact with people who tested positive and get them to quarantine. I think it will also be especially helpful in reaching out to our communities where English is the second language. So if we could, to be able to reach out to those people on a one-on-one basis to do education and communication, that sort of thing. We're also looking to, starting tomorrow at 5 o'clock, tomorrow at 5 we'll be doing a Spanish language only broadcast press conference. So that will be another way that we're trying to do a better job communicating to communities where English is a second language. We currently translate our press releases into Spanish. We're also doing some of our social media in Spanish. We've got to blow that out into other languages as well, so we're seeking some translation services. And again, this might be an area where schools and their ESL folks can be helpful to us. In particular, I want to thank Dr. Grover for the work that you're doing in Grand Island to help reach out to your families there, so that's really, really helpful. So, we got a lot of things that we're pushing forward to really try and get our arms around the contact tracing and do a better job of communication so that we can get people to stay home and quarantine and isolate to slow the spread of the virus here in our state. So those are probably the big things that we got going on right now. So with that, if there's questions, I'm happy to answer them.
Yeah, thanks, Governor. So actually, you're welcome just to kind of stay on as a panelist, and we're gonna go back up and start. I have my commissioners advisory group, and so I have 3 superintendents joining. Oh, excuse me, I'm gonna do the non-public first. I forgot that was on in advance of that. So Dr. Ashton from the Omaha Archdiocese is here, and so Dr. Ashton, thanks for joining. And I thought maybe we can just talk for a couple minutes about kind of your work. And by the way, I've seen Dr. Ashton's communication with his with all of his schools. I thought it's really been outstanding. So thanks, Michael, for everything you're doing on that front. So
I appreciate it, Matt. Thanks, Commissioner, and thanks, Governor, for spotlighting the kind of the unique challenges that are facing our non-publics. that might be a little different, and I appreciate the time to highlight those and to talk some about our crossover with our public schools and ESUs, where there are some blurring lines of these boundaries, and I think that's an important consideration, because when we have an ESU with several public school districts that are talking and planning, it's hard to determine which non-publics you're sharing families with. It's hard to determine how your schedules might impact the sharing of resources or coordination, or just the convenience for families that might have an older child in a public high school and a younger child in one of the non-public schools. So any effort on your part between ESU superintendents and other public school leaders to look on the map and consider which non-publics are most affected and bring those folks into your decision-making very early. Some of you might not know the decision-making structure in our non-publics. Typically, for instance, in the 20,000 kids in our system with the 71 schools, those 71 schools are all determining their own unique schedules. So you would not invite a superintendent, Greg Logston or Grand Island or Matt or myself. You'd be inviting the leaders of those schools to the table to talk about coordinating changes. And I'm thinking specifically forward to the fall as you consider the what if scenarios, as we learn more when testing ratchets up and we learn a little bit more about what might happen in the fall. Please do pull in those principals, pull in those school leaders in the non-publics to co-plan with you, and it'll benefit all of us. And that goes also consultation, season of consultation. Certainly we're in the midst of that. And that's been just a real bright spot in the public and non-public relationships. I've seen just in the 3 years I've been here, improve relations and communications between the publics and non-publics on how to manage federal dollars, specifically the title dollars. But in this scenario where waivers are coming through at different times and where there might be rapidly changing scenarios, we really appreciate the openness to reopening a consultation if necessary. And ESU coordinators and superintendents really pushing that information fast down to your folks that are going to attend those meetings, because we've already run into a couple cases where the people on the ground aren't hearing the changes in the waivers, and create some confusion for our non-public and public consultations that are happening. I encourage everyone to be looking creatively at some solutions. I have to share with you that our non-public schools, and I can speak specifically for the half that are in the Catholic system in Arch Omaha, but I know this is common to the folks that are the non-publics in the other two dioceses, that we sit in a very precarious position, our scale being much smaller and so much of our system being supported by wage in a time that income and wage is just bleeding out right now. Our schools are going to have to change rapidly and be very agile in their solutions as those financial conditions become more dire. And if I could ask for your prayers as well, when you consider the teaching staff in our non-public schools, I don't think it's a secret that we do have a lot of retirees. We do have a lot of religious that are 60 plus, 65, even 70 years old teaching in our schools. So our forecasting for how this virus might affect us is a little more dire. And I worry about those servants in non-public education that are in that category that has a mortality rate upwards of 10 to 16, even 20%. These are future considerations we have to share with everyone to understand that there could be some drastic changes to the structure of our schools and how we run them, how we staff them in the coming 6 to 12 months. So I really appreciate the time, Commissioner and Governor, to spotlight some of these unique situations and things that I know that my public partners in Omaha have been very sensitive to, because we've been meeting on a regular basis. It's been very helpful to me in the messaging out to our schools, and I encourage all ESUs and superintendents to do the same.
Yeah, and thank you, Dr. Ashton, because I think and I hope, and I guess I would kind of re-invite in case we have any folks on the line from our non-public schools, to encourage you to be part of the conversations with ESUs. And I encourage, maybe we'll have to kind of re-communicate about some of those things, but it is really helpful to get feedback from all of our schools across the state. And I really do appreciate everything that folks have been doing. I think we have a meeting. I was trying to get it reset into my calendar, but I think we finally did that. So Wednesdays I'll have a meeting with non-public school leaders. I think we're going to get that as a routine here for a while too. So thanks again, Dr. Ashton, for being on, and I really do appreciate the partnership that we have. So I want to kind of move down to the Commissioner Advisory Committee, and so we have 3 superintendents joining. And kind of topic by topic. So Dr. Logan, appreciate you being on today. Omaha Public Schools, obviously, you know, every school is dealing with, you know, circumstances of this nature, but I was really pleased to see the work that you were doing around technology and talking about to kind of address the technology gaps that we may have across the state. And I thought it was a great example of one area where you've been already thoughtful of thinking of how to close that gap. So I turn it over to you for kind of your insights about that, and thanks for being on.
Thank you. I appreciate it. And hello to all my colleagues. You know, when the pandemic started, which seems like it was a long time ago, but I know it's just about 6 weeks ago, we talked about how we were going to approach this distance learning. And so we decided early on that, you know, what do we have available to us now? And realizing that we likely would deal with it based on the information that we had at that time at some point later in the calendar year. So we decided to, with our middle and high school students, to give them the technology that we had, realizing that some would have internet access and some would not. So we posted information in a few places because we realized even if they did not have internet to do their on a internet in the household, they might be able to use a phone as a hotspot. And then we also obviously did the Cox to Connect, which many, you know, it's not anything remarkable. So many of my colleagues have done that or are doing that. But we made a decision to do packets in elementary school, and realized that we were going to had to change our approach because we are a cruise ship, but all of our schools are like swift boats, right? And how do we facilitate or promote schools being able to figure out some of this on their own? So like I said, all of our high schools gave out machines. Our middle schools gave out machines. They still continue to give out machines. A kid contacted me today because he said he forgot to do it and could I help him? A lot of kids reach out on Twitter. And so that was our approach. And we knew it was going to be piecemeal, and that we were not going to be able to solve it between when the pandemic started and the end of the academic year, because we would have to train everybody on new devices, give out 54,000 devices if we decided to go with new. When we also spoke with, I'm an old chief academic officer, when I spoke with vendors, I know vendors well, I know what they promised, and we as a district were not gonna buy any old machines that they couldn't sell that were sitting on their shelves that we knew they were more than willing to push out around the country. So as you hear these stories, and many of you know I worked in a large district, so I know all those people. When you hear these stories, I actually know what they bought. So we decided that we were going to, looking at the amount of money that we were going to get for the next academic year, we are buying devices for all of our children that have internet connectivity built into the device in LTE. And we also are getting those for our paraprofessionals, because we're going to continue to work and get paid. How do we leverage them working one-on-one and checking in one-on-one with children with a schedule? And so that's been our, that's kind of how we're looking at it. We also are ending our school year 5 days early. We have 7 days after that. 5 would have been children days and 2. So we created a plan. There are 6 one day where teachers can pick up their items, close down their rooms. Some teachers will help with technology collection in the high school and middle schools. And then they have 6 days that they will use during the summer for virtual PD. The entire calendar for virtual PD was created in a week. It is a masterpiece. I have to give my folks huge credit for it. I sent a copy to Dr. Bloomstead, but I can send one because now you can see every course that is available. We broke it down into hours rather than days because nobody should be sitting in front of a machine for 7.5 hours. So people can take 2 hours, 3 hours. Some of the learning is synchronous, some of it's asynchronous, and it takes place over, I want to say it's almost a month in between when school lets out and May 22nd, and then or so, and then the beginning of summer school. We also are purchased 2,000 of the devices that will be delivered immediately that we will use for our distance learning summer school. And we put together that platform. But we decided that we can't, if we're gonna give out devices, we must give out internet. We have to put that into our cost. And we also have to think about staff. Our lowest paid, some of our lower paid staff, expecting them to have high-speed internet is not something that probably is a realistic expectation, although many do. We have to be able to guarantee that, and so that's the way that's our approach moving forward. 6 days of training for teachers and for paraprofessionals, and to include 3 days for principals on how to lead during this time. So nothing super remarkable, but realize that we've got to, you want to stick your toe in and then your ankle and then your whatever, but we all got in the deep end really quickly, and hopefully moving forward, we'll be better prepared, God forbid. We are in this situation or whatever time, looking at a blended approach, just moving forward, period, for our teachers and kids.
Well, thanks so much, Dr. Logan. And I think what we're really running into and finding ways to close the digital divide's really been kind of one of the concerns that we've had for a while. And I appreciate kind of your thoughtfulness around it, especially with the LTE enabled devices, because I think that's, kind of, as they say, kills two birds with one stone, although we're not really interested in killing anything right now. So thanks for being thoughtful around that.
Yeah, I think, the waiting piece was probably, the most risky for me, obviously, as a superintendent, but I had to look at what the landscape was and what we could do well. Also really concerned with health and looking at in systems where people passed out machines, many more of their employees got sick. And those kinds of things. So it was really you really had to do an ROI, not just for what you were going to get instructionally, but also how you were going to use your staff during a time when it's not just a snow day. So it was, those are all the kinds of things that we took in consideration. And, you get some slings and arrows, but, they were worth it. I think they're going to be worth it in the end, especially when we're able to lift virtual summer school. Although I will tell you, Matt, I think that virtual summer school is an oxymoron.
Yeah, we've probably got several oxymorons out there right now. And some people just call me a moron. So that's how that goes too.
I didn't mean it like that, Matt.
It's all right. No, thank you very much. And I'm going to do what I call my coast to coast. I'm going to go clear out to Gering and invite Bob Hastings to kind of join me and see how, kind of what the perception is out there. And one thing I can tell you about what I've seen from Bob already and out in the Panhandle generally is their kind of their emergency response and their partnerships out there, I think, have been remarkable. So Bob, are you able to join me now? I can't see you on the screen here. Oh, there you are. So.
Yep. Thanks, Commissioner. Appreciate it. Appreciate you having me. Our approach hasn't been entirely different from the approach that Dr. Logan talked about at OPS. We've really we made some decisions early on that we knew it probably wasn't going to be practical to try to deliver instruction to our elementary students in an online way. And so we made that decision to go packet-based with our elementary students. We had enough devices to go one-to-one with our junior high, but they didn't have them in their possession when the shutdown happened. And so we had to scramble a little bit about that. And our high school kids were pretty well prepared for that. But, one of the things that we've really struggled to work through a little bit is just, throwing online education out there has been way better than the alternative of doing nothing. But we know it's not as good. There's a reason why kids come to school every day. And developing those relationships between the teachers and the kids is, you know, a big part, probably 70% of learning. And as much as we try, it's not the same. We've probably had about 70 to 80% participation at our junior high and high school, which under the circumstances, I think we're pretty happy with. And at the same time, if we had 70 or 80% attendance when we were in school, we would be very alarmed. And so working through how to better engage our kids is going to be a big piece of this. And certainly, Commissioner, you caught our attention last week when we started to talk about this might drag into the fall. And we've thought about it, but I think all just kind of closed our eyes and hoped that it wasn't going to be the case. And so we've started to have some pretty hard conversations about what that could look like for us if we have to come back in the fall. We're a little bit behind in the progression of the virus in the Panhandle. We've been a couple to 3 weeks behind. I think our first case was announced around the 1st of April. And at the same time, we've had it coming at us from a whole bunch of different directions. We had to worry about what was going on in Colorado. Fort Collins is within 100 miles, the way the crow flies. Cheyenne's about 75 miles away. Torrington's 30 miles away. And so watching all of those pieces as well has been an interesting thing. And I think for us, as we go forward, figuring out when we can open up, we're just going to be on a little bit different time frame, I think, than other parts of the state. Our superintendents and our ESU worked really, really well, have continued to work well together. Initially, we made all of our shutdown decisions as a group collectively. Those were, at first, it wasn't too bad, but as we got into this a little bit further and there was a lot more uncertainty, there had to be a lot of conversations, but everybody was willing to share their impressions and their thoughts, and I think take some leaps, knowing that we were all going to be better working together through these decisions as opposed to trying to do them one by one. And so just a compliment to our area superintendents and to Andrew Dick, our ESU director, who did a great job of helping us through all this, and Panhandle Public Health. One of the other things that we've been working through is summer school. I am of the same opinion as Dr. Logan that a virtual summer school is probably not the most ideal approach. And one of the questions that I do have maybe for you, Commissioner, or for Governor Ricketts, is if we get to the point where May 31st comes and we can not officially have our schools closed, would we be able to run summer school like under the same operating rules that like a daycare can run under, that as long as they keep 10 or less in a room or in a group, could we operate that way, especially at the elementary level?
Yeah, I'm going to have the governor, I think, if he's willing anyway, to kind of address that. And I know he and I've talked about it before, so Governor.
Well, you're going to make me go first? You're the Commissioner of Education.
Oh, okay. Well, I can talk about it first. I think,
I was going to say, I think that is a reasonable approach. And, again, a lot will depend on where we are a month from now with regard to, looking at going into June. But I think that, as a minimum standard, having, the same kind of guidelines for kids in daycare, I think would work. But Commissioner, you're the Commissioner, so you just got my opinion, but you're the one who's in charge.
Yeah, no, and I think where we're at, and I think it's a fair point, and I know truly the governor and I have had this type of conversation about how daycares might kind of be a model for cohorting students and thinking differently about that. It's really going to depend on what happens throughout May. And Bob, as you said, I'm really concerned not just about the Panhandle versus the eastern part of the state, but we're on a different timeline than the nation, and some of the states around us are on a different timeline than the nation. And I will say that I appreciate very much the governor constantly being thoughtful about talking to our local health officials and doing that. So my suspicion on this is we'll have those regional conversations and continue to do that. If something looks like it's possible, then I think we can start to have that dialogue. I think right now for folks, just from a planning perspective, to plan remotely and maybe hope for something better than that. But that's probably my best, kind of 2 cents at the moment. And you know, that's probably about all my thoughts are worth, is about 2 cents too sometimes. So appreciate very much the thoughts. Hey, I'm going to jump to Dr. Grover. So coming back to the middle of the state, and so Dr. Grover, I think I speak for all of us when we've been watching kind of conditions in Grand Island and now really kind of the surrounding area. So when you get into Adams County, and as well as Hall County and to Dawson County, and other areas of the state. And I think the governor spoke to the point around concerns around anything in language barriers and other things. And just thanks for your help on those fronts. But I'll turn it over to you if you're able to share a few thoughts on kind of what's happening right now in your area. And thanks so much again for being on.
Yes, thank you so much, Commissioner, for having us. You know, I like to say that when we have credible information, it helps us to make very critical decisions. So thank you so much, and to the governor for your consistent updates, because we really depend on those to kind of move us forward. And so when we first started on this journey in Grand Island Public Schools, I mean, we've been very fortunate to work with our area GI schools also, along with the Tri-Cities schools, Hastings and Kearney. And I will tell you, our ESU 10 Executive Director, Dr. Wheelock, she definitely keeps us informed. And so I just want to thank all those folks for all the support that they provided, because it takes all of us thinking about this, and particularly in Grand Island with our numbers and the support that we need. When we first started out, we had 4 very specific priorities, and I'll talk a little bit about maybe how our priorities have kind of shaped as we have learned more and as we continue to watch the state of affairs here in Grand Island. So as far as e-learning is concerned, I think we're probably on the same page with all of our colleagues around the state. We've also been thinking about the long haul, and just knowing that we may need to be in this e-learning space for a while. So we've been a one-to-one district for quite some time now, and so that really helped us to maybe move very quickly to be able to roll out the e-learning for our students. But we also had to support our staff, and so we're continuing to have PLC meetings along with principal meetings, professional learning. All of that is happening in the virtual space, and we're thinking about just summer school, report cards, registration, and even graduation. So when we think about Hall County and Grand Island, anything that we can do through a web-based format or virtually, that's really the approach that we have right now. We ran payroll for the first time working remotely last week, so I didn't get any complaints. So I think that everything is working pretty smoothly. So just doing it from a remote space. As far as equity and access is concerned, we really look at that from our students having internet connectivity. And so while they had devices, we did have about 150 or so students that needed internet access. And so we were able to go ahead and purchase those jetpacks for our students. And we even had some students in a homeless shelter. And so we were able to work with that shelter to get internet access to those students as well. So we feel really good about, pretty close to 100% of our students having internet access to continue that e-learning. But the communication part is a big part of that equity and access, making sure that folks have the information and they have it in multiple languages. And I think the call to action from the governor just really helped us to amplify that a little bit. And so we are conducting virtual town halls. And so, for example, we have one at 6 o'clock that may be in English, and we follow up immediately with one in Spanish. We've also called on some of our, I would say, community influencers to do some PSAs for us. We had our coaches, because we know our students respond to the coaches and their fine arts teachers and so forth, to put out some messages on safety, on staying at home, staying away from the parks and those types of things. So they're able to push those messages for us. And we also have some students, because the students, they speak a lot of different languages. So really leaning in on your students to help you with that communication. As a matter of fact, we have a video out that our students actually created, and they made it, and they're speaking in 5 different languages. So, hey, anybody can continue to just help pass that message on across the state, because I think we have a student from Northwest that's in the video. I think we even have a student from Canada that's in the video, right? Just to be able to get those languages out. And that's all working with our students. We also do a story time live every evening. We do it at 7:00 p.m. And we have thousands of people that watched someone read a children's story to our students. And again, we have some public faces out there, people from the media, teachers, of course. But when we do those messages, we're also making space intentionally to push the safety feature. So if you have a family that's sitting there watching it, they're going to hear those same messages often through that same space. And part of what's happening in Hall County is really making us think about our community at large and how we really have to work together and be flexible as a school district. And so we are building very specific student case management plans. And so I bring that up because of just like the workforce. So we have a lot of our parents that are not able to work. And for many of our students, they are the breadwinners at home right now. They're the only ones that may be bringing in some income. And so we are working with those students and with their employers to make sure we have a flexible schedule with our students because they do need to work, but they also need to make sure that they have their academics taken care of. So just that flexibility and what that e-learning opportunity provides has been helpful. We have also worked with our Hall County Collaborative. They've been certified by Red Cross to be able to offer trainings for our students so that our students can also provide some babysitting services if needed. So, I mean, I think that's the strength of Grand Island, just a lot of communication as well as a lot of collaboration. And I think the next thing that we're looking to tackle, because we had a little scare last week, and that was around meal distribution. And so we're really thinking through what if we have to shut down. Right now, we do have a rotating staff if we have a person that's been identified, and we haven't really had any large cases of our staff members, but maybe their spouses have been a confirmed case, and we may need to make some adjustments. So we have staff members that we can cycle in, you know, every 14 days if we need. But if we have to shut down a site and we're no longer able to be a distribution service for the city, what is that going to look like? So we formed a task force with some community leaders to start a think tank about how can we use the restaurant owners or some other distributors in town to be able to continue to get the meals to our students. So just, again, just a great deal of collaboration. I really appreciate you, Commissioner, because your folks they called us on Friday and they were ready to help us if we needed to shut down. So it takes all of us working together.
No, and thanks for some wonderful ideas about how to use and partner with students to communicate and with families. And I think that's, and Governor, I can tell you, I know I got a phone call from well, your chief of staff, so from Matt just a little bit maybe before this call. And so I think we'll certainly be open to thinking through more strategies. And thank you, Dr. Grover, for providing some of those strategies around communication and response. So appreciate that very much. So I just actually have one more panelist, and we're right at the coming up on the end of time, but Jeremy Eshleman's joined us from the Two Rivers Health Department, representing kind of the south central part of the state. And Jeremy, are you able to join us there? I think you're unmuted. So
yeah, good afternoon, Commissioner. How are you doing?
All right, great. Thank you, Jeremy.
Hey, fantastic. I don't have a whole lot to report, except we're working like crazy right now. I think as a few of you may have mentioned already, and we appreciate all the partnership with Governor Ricketts and his team that's occurring. So we've had the National Guard out providing some enhanced testing this last week, Friday into Saturday, and then we're also doing some today into tomorrow. A lot of the results that are coming back are related to that enhanced testing in addition to our local clinicians' results coming back positive. So we have a pretty high positivity rate now. We're projected to actually exceed 200 total cases in Dawson County today is what we're projecting right now. I think our press release is still under development, but the initial numbers I saw we're going to be well above that. So other than that, I think at this point, we're trying to get information out to a lot of our employers, just making sure that the great guidance that's out there, that they're doing their very best to adhere to that. And I think we have a lot of folks in our district that really want to do the right thing at this point. So Other than that, I don't have a whole lot to add, except we're just trying to add on resources as quickly as we can. We've been adding about a couple people each day and trying to expand our team. And just to give you an idea of the work that we're doing, we have a team of about a dozen people, and it's quickly swelled to about not quite twice the size, but we're getting close. And so, in giving an idea, in Grand Island, they have a team of I could be off base here, but I thought around 25 or 30 people. So that's kind of an uphill battle we're climbing now, trying to add resources as quickly as we can. But sure appreciate being plugged into the conversation, and let me know if you have any specific questions.
Yeah, no, and very much appreciate all of your efforts, Jeremy. I think the main point for us is just to kind of keep these conversations going. And I know with a lot of public health officials, especially Jeremy, I can tell just from as the numbers grow for out in your area that the workload is obviously growing substantially. So again, just I think all of us from a school leader perspective and everything you've heard today, I hope we can continue to be helpful for you. So Governor, I'm going to give you a chance at a last word if you're still on with us, and thank you again for taking time to join us. So.
Well, my pleasure. Thank you for having me on, Commissioner, and I appreciate the great working relationship that we've had as we go through this pandemic, and just wanted to thank all the great leadership we've seen from the superintendents across the state, all the things you're doing to adjust to something that I know the word unprecedented has been used a lot, but it certainly is. We've not seen this kind of thing in our country in over a century, and we're all learning together on it, and I really appreciate everything you're doing. I'm really impressed with what I heard from Dr. Logan and Dr. Grover, and just, again, thanks everybody for what you're doing, and we'll just keep working together.
Yeah, thanks a lot. And so just to remind folks, you can still post questions on our website. We'll work on a platform next week that will have a Q&A section on this. I encourage folks to continue to get questions into the regional conversations, and just thanks to everyone. I know it's a lot, and we got more information probably coming out yet, and like we have seen almost on a daily basis, new information's hitting us. So thanks everyone. We will do this again next week, again at 4 o'clock, and take care.